Thank you so much for joining us today. My name is Shannon Allen. I'm a board member at CI. I feel very honored to be a board member at CI. My grandfather was the Commissioner of Minority Small Business for the state of Connecticut, and this gubernatorial appointment for me felt like I was carrying the baton for my grandfather, Francis Silva, and really being my ancestors' wildest dreams. So it is a privilege and an honor to work with people like Allison and Lauren and Emma and Matt McCooey. And we have an honor today to be joined by three extraordinary entrepreneurs. Vlad, the CEO of Biohaven, Andre Swanston from TruOptic, and Mike Weiner from Abbratech. And so this morning is going to be a very casual conversation. I will be moderating. I'll be playing host. And we're just going to jump right in and talk about our entrepreneurial journeys, what it's like to be an entrepreneur in the state of Connecticut, what the work that CT Innovations is doing, the very important work to support small business owners and entrepreneurs in general. And I'd love to start with a very simple question to all three of our panelists, if that's okay, about when they knew they were going to be jumping in to this gritty, insane field of entrepreneurship. Vlad, let's start with you.
Well, that's a great question, and you don't know until it really hits you, right? Because I never took a business school class. I never had any intention to be a CEO of a company. Never thought I'd be in the business, world. But as we were just talking before the panel started, there's major problems that we have in healthcare that are unsolved. And so as a clinician, it hit me like I had to do more about this. And so entrepreneurs, I think at heart, solve really difficult problems. And so if I wanted to bring better treatments to patients, I had to learn the business side, right? I had to, my strengths and comfort zone was science, but I had to get uncomfortable with learning new areas, like drug development and the business world, and how do you develop a drug, how do you launch a drug, and how do you solve some of these problems. And so for me, that's what drove the passion to start Biohaven, literally starting it, out of my spare bedroom and wanting to make a difference first in brain health, but now in other areas as well. And so that was the entrepreneurial kind of spark and passion for me.
And you started really as an academic, as a psychiatrist. You're a doctor. Your father was also in psychiatry, and your mother was a pharmacist. So you saw science in your household. Where did you see the entrepreneurial gene?
So what I saw growing up in that household, and also I grew up on the grounds of a state hospital where they worked. And so I interacted with patients with severe mental illness, like bipolar disorder, schizophrenia, and saw that their lives really were stolen, from them. And so again, that entrepreneurship comes from, I want to solve that problem. And as a clinician, nothing's changed in our field 40 years. Right? Wow. We really don't have any effective treatments for bipolar and schizophrenia. When you look at the treatments we have, they make things better, but they're not cures. And people with those disorders deserve cures. And I saw the entire pharma field abandon neuroscience. And they said neuroscience, and in particular psychiatric research, is too risky, so we're all leaving it. And so for me, that was the opportunity. So others saw too much risk, that there could be kind of catastrophe in this field. If you went down this path and studied these disorders, you'd lose money and you wouldn't get effective new drugs because of how difficult it is. Everyone leaves the field. For me, that was the entrepreneurial opportunity. There's a problem, it needs to be solved. And, I stepped up and, literally quit my job when my wife and I both had student loans and, 4 kids at home. But I think the mission was too important, and that's what drives most entrepreneurs, is their passion to solve problems like that.
And the beautiful thing about what you've done and you continue to do, and I want to thank you personally for the work that you're doing, is that when you're solving the problem, you're helping people's lives. Everyone else in the pharmaceutical world may have been saying, this is too risky, this is going to cost too much money, there's too many problems here, there's a problem for every solution. And you're saying, but if we don't solve these problems, more people are going to lose. And I think that at its purest form of entrepreneurship, when you're solving problems for people. And that's what really makes this thing work and what makes it magic. And so I want to jump to Michael. Mike, we talked a little bit before we jumped on the panel about the work that you're doing with Abbratech and how in your personal journey now, also as an academic, as a doctor, as a researcher, and a scientist, a biochemist, this is the first time in your career at 70 years old, but he looks 40. I think we need to get the skincare routine after this. For sure, for the first time in your career, you're also the CEO of this massive company, and you're taking on a completely new role, a little bit outside of the lab. And so how does that transition feel for you now with the work you're doing at Abbratech?
But it's different. I had a conversation the other day with some of my direct reports that, my major goal is one is you report to the board, that's your customer. The other is that my responsibility is making sure everybody's employed, that we have enough money and all of that. Their job is to make sure that they can get their projects done. Our operations person is in charge of making sure the doors stay open. And it's completely different. When I was a CSO of all the previous companies, it was really just about focused on getting the job done. And now it's changed. Do I like it? I like the science.
Yeah.
I'll just say that.
So I have a follow-up question for that. Everyone in this room has some degree of entrepreneurship or desire to be entrepreneurial or supporting entrepreneurs in some capacity. And a big part of that is raising money so that you can keep the doors open, raising money so you can get the work done, so you can scale and you can help more people. If money wasn't an issue and there were unlimited resources and funds for you at Abbratech, how much more work could you get done?
Yeah, that's a good question. I think I'm still too much of a CSO to think that I would get much more. I think I spend more of my time as thinking about the science than I should. I should probably think more about, like what I was saying, of the other things going on.
And what is the problem right now that you're most passionate about that you guys are solving?
I saw that as one of the questions. Was it that whatever I'm currently working on tends to be the thing that's most favorite, because if it wasn't my most passionate, most favorite project, why am I doing this one? And so what's my favorite one is the next one, what I'm thinking about now. We're working on antibody discovery right now and approaching it from a different area of making site-directed antibodies. So how do we focus the immune system to hit single sites on proteins? And we've accomplished that. And it's really neat. It's breaking open. The problems that we want to work on are things people aren't even thinking about yet. Because if they're thinking about it, it means there are other people already working on it and giving thought, probably smarter than us and better funded. And so what we're trying to do is try to figure out what people will need in 3 to 5 years. And because it's going to take us that long to deliver that result.
And that's what a true visionary does. They're thinking about solving a problem that people don't even know they have yet.
Okay.
And Andre, it's kind of what you did.
Is it?
Yeah, I think so. So Andre started out in an immigrant family from St. Kitts and Nevis, grew up in the Bronx, went to Hotchkiss Academy, and then ran track at UConn, started out in the entertainment business, the very successful nightclub, flipped that into other entrepreneurial efforts, ended up being one of the youngest vice presidents at JP Morgan, and had a massive exit in his own company that he started where he collected data. So you solved a problem early on that ended up being a massive exit for you, one of which that CI was invested in, that maybe people didn't even know existed. You were collecting data from folks before people knew that data could be used and advertisers would be interested in buying it. How did you have the crystal ball?
That's a good question. So when I was 23, after UConn, I opened a nightclub up in Stores. You may remember, there was old Big Daddies. I bought that and turned it into Club Tipsy. I also promoted a lot of concerts and events all throughout Southern New England, from like Springfield to New Haven. And what I realized was in the early 2000s, you could get 1,000 people to show up anywhere if you had ads on the radio stations, if you had ads in the local newspapers and you hired a street team to go hand out flyers after the let outs of all the bars or put flyers on cars. You could pretty much get people to show up anywhere. As things transitioned, that really wasn't effective. You had to buy streaming ads as people were starting to stream radio on their laptops in the dorms. You had to advertise on Facebook and on digital. You had to have people interacting on social media. Like maybe back in the day, it was AOL Instant Messenger, then it was Google Chat, then, all these things that are there now. And I just saw that everything was switching to digital relative to kind of people's leisure activity. I was at JP Morgan at the time, and everybody thought, every one of my clients, I was on the wealth management side, every one of my clients thought their next door neighbor's son was the next Zuckerberg. It was like, oh, I need to take out $250 for this. I need $500,000 for this, $1 million for that. And these were some of the stupidest ideas you've ever heard of. And so I said to myself, okay, I know that I was aware of kind of this transition to things called like streaming dongles, right? Early Roku. This is, say, 2011 when I started to realize this, and I was saying, wait a minute, if you're going to start to be able to have more of this digital experience that you have on laptops and mobile phones on your TV, that TV is where the real advertising money is. That could be really transformative. But at the time, everything was done off of panel data, Nielsen, right? You have 50,000 people and you extrapolate that up to 300 million people. Whereas on digitally, everything was more census level, right? It's 1-to-1 with digital based on cookies and stuff like that. So I knew that things would have to change in the way that data was used, measurement, targeting, all that stuff, and TV was a big opportunity. I wasn't an engineer. I'm not a coder. I was the business guy, the strategy, the marketing, the capital formation. But a kid that lived across the hall from me at Hotchkiss my senior year was a triple major, like mechanical engineering, math, and computer science at Carnegie Mellon. I mean, this kid was the smartest kid I've ever met in my life in high school. And I just reached out to him and said, hey, I have this idea. And he was like, yeah, I could build that. And I quit JP Morgan with a 2.5-year-old and a 6-month-old. We started the company. Now, this is 2013. Nobody cared about, you're going to have a company that's going to extrapolate data on streaming television to be able to do targeted advertising, because streaming television was like this and targeted advertising was, you couldn't even see it because it was all subscription based like Netflix and stuff like that. But 2020, people cared a lot. By then, you just got to keep going. 7 years later, people cared a lot. We sold the company.
How do you keep going when it gets hard?
So I have this just feeling like if it isn't hard, it's not worth it, right? So like the whole concept of like keeping going, how do you keep going when it's not hard? Like, I just feel like how boring and meaningless can things be? Like, that, to me, that's like the worst. Like, if I'm not busy or there isn't something at risk, it just seems like, what is the point? So it's like, I don't even think that way. Like, how do you keep
live
going
in
with this?
post-traumatic growth. Chaos is your normal. Duly noted. So when we talk about entrepreneurs, a lot of times we have this idea in our mind that like it takes a special breed to be an entrepreneur. Vlad, when you think about that, what are some of the necessary skill sets in the bag of tricks to be an entrepreneur?
Well, there's a few, and one you just touched upon, is resilience. You have to be resilient. You can never give up. And when you think about it, we are trying to solve some of the hardest, difficulties out there. And what I find is that people will always tell you why you can't accomplish your goals, right? You have to look and surround yourself with people who will help enable your success, right? And as an entrepreneur, you better be ready, to have a thick skin and listen to people who say, you can't do that. that you're going to not be successful, or that's too, difficult, and seek those out, who are going to help you. Never give up. So I think that's one attribute. Passion, I mentioned earlier, entrepreneurs are passionate about their area, whether it's marketing or other areas, that's their passion, that drives them. And I think you also, the third kind of thing I think of is you have to be an eternal optimist, right? Because you're trying to accomplish something that everyone else has failed at, and that optimism is what's going to really, drive you through your entrepreneurial journey. And if you're not an optimist, you're going to be depressed about things and focus on all the negative, focus on the positive, focus on what you're trying to accomplish. And, in my case in healthcare, focus on the patient. Like if I deliver what I want to for patients, like everything else works. Like the business model, works. And so, I think that optimism is what you see in a lot of entrepreneurs.
And I like to say delusion.
That's right.
Right? Like, because people are always going to tell you can't do it. But we're sitting at a no right now. Why be comfortable at a no? Like, someone is eventually going to get you to a yes. So you need that delusion of optimism to constantly push you forward. Otherwise, none of this would be here. There'd be no Yale. Someone thought Yale was crazy. Andre, what do you think when you think about what is required of you in order to be an entrepreneur?
Pretty similar. So I would also call it ego. You got to have an ego. Everybody shows it differently, but I've never met a successful CEO or athlete or anything that doesn't have a big ego, right? Some people are more boisterous. Some people are more quiet. But if you don't truly think you are the best or can be the best, then why would other people follow you and believe in you as well, particularly when you're trying to do something difficult? I think the other thing is, and I've learned a lot, I think, from angel investing over the last 4 years or so. Because the mistake that I made early on when we first exited, I was just throwing money around. I wish I could get some of that back, right? And because I was more looking at the idea and maybe the technology and thinking like, oh, here's what I could do with this. Oh, I could turn this into this. But not everybody is me. And I don't mean like some people are better than me, but I'm just saying not everybody is me. And most of those instances, it just wasn't successful. The ones that, 4 years later now, have raised multiple up rounds or even been acquired, frankly, were some of the ideas and some of the tech or some of the companies that were least impressive. But the founders they didn't care. They just were going to keep going. They're the ones that could hear your advice and know when to take it and when to disregard it, because they know their business better than you, because they had the ego to be like, yeah, that's great, but I'm still going to do it this way. It's so the one thing that I'll say, I've taken away, good founders, good entrepreneurs, good egos, they soak up everything. They have big egos or confidence. They're able to listen and gather things to make decisions, but they don't just listen to what investors say, because investors aren't always right, and they don't they know they're not always right. Like, if you're always right, you're an idiot, and if you're always wrong, you're useless.
Mic drop on that one.
Yeah, I just came up with that.
Yeah, that's good. I like that. If you're always right, you're an idiot. If you're always wrong,
useless.
You're useless.
Because then if you're always wrong, why do we need you?
Right, exactly. I also think people invest in people, not ideas.
Well, I learned that.
Yeah. Mike, what do you think? What do you think is required of you to be an entrepreneur?
I certainly do. I mean, my wife's not here, so I could say this. There are a couple companies I've invested in over the years that I have no idea what they do, but I know the people who did it. Seriously, I have absolutely no idea what they did or are doing. I think ego is probably it. It's to me, it's betting on myself. It's worrying about the investor's money, making sure that they get a return on investment is very important to me. Making sure I'm putting something out there my friends could look at and say, yeah, I could use that. So I'm a tools guy, so that's what I built, is tools. So I'm interested in being able to give them the ability to do things. And so as an example, I worked at Glaxo Wellcome for a while. Great company, really admired the people working there, really committed to solving diseases, but I was there trying to solve the problems that they were using to solve diseases. So eventually I had left. So I went from a small biotech to GSK, which was the largest pharma at the time, and left because I wasn't as interested in the disease. I was interested in helping those people solve the disease problems. So again, it just depends on what drives you and trying to figure out what you want to do.
Andre, you said something a minute ago about, I wish I could get some of that money back. And I think we all, as entrepreneurs, have moments that we wish we could have a do-over on, like a mulligan. What is one of those for you, besides just like calling friends and saying, hey, I wasn't so sure about that after it all?
I would say outside of two founders that I just don't think deserved what I gave them, some things are going to fail. You could find the best entrepreneur with the best idea, with the lots of capital and blue chip investors, and they could still fail. Happens every day. But there's a difference between like deserving like putting the work in and doing the things that make it a real try. So I think two people that just weren't deserving of it, that's one thing. But I think about quite often if I sold my company too early, right? I see what multiples people got 18 months later. I know how much revenue my company became a division at TransUnion. We 12x'd revenue in the more than 12x revenue, I think, in the 24 months after the acquisition. At the same time, hindsight's 2020. At the time that we sold the company, it was, we made the agreement to sell the company in summer of 2020, right? And so I knew that, wow, this streaming thing is skyrocketing. No one was caring. Everybody cares. Sell it at the high, do certain things. If back then, I don't know, sometimes we have short memory. We weren't sure if the world was going to be around 6 months later.
Exactly.
And I remember thinking to myself, I can be rich right now. This is life-changing, right? Or I could hold on longer and maybe make even more money. But what if in 6 months from now, I literally thought this. What if it's like in 6 months from now, there's bunkers or there's like boats and only the rich people are getting on? I'm being dead serious. And I was just like, you have a responsibility to like save your family. I'm being dead serious. Like this was part of my thought process. And then I was like, I also can make all my investors a lot of money, right? And then I'll have the credibility to do it again in a couple of years. I had 2-year earnout. I was like, I'm back in 2.5 years. Like I remember thinking that. So, but then when I look at some of these companies, I'm like, damn, I could be a billionaire right now if I had held on. So that's one thing. But I don't know if it's a wrong decision, but it's something I frankly think about on a regular basis.
Yeah. I love how honest that is, because I think we do that all the time. It's one of those things where you get in there and you're like, this person just sold for $1.2 billion. They started their company 2 years ago. It's like a super unicorn with like glitter coming out of its butthole. It's crazy, right? So I don't blame you for having those thoughts, and thank you for sharing that, Vlad. What about you? Do you have any things that you wish you could rewind time on?
That's a tough one for me because, do-overs aren't reality, right? In an entrepreneurial world, you don't get to have a do-over. And I think if you get too caught up in do-overs, you're not focused on the task and the decision at hand. And so I think, Andre, you were getting this earlier about, like, you have to learn everything about your business. You're not going to be right all the time, but you have to be right, majority amount of the time. And you have to be willing to take those risks, and you have to be willing to be wrong and to have failures. And so I kind of embrace my past failures. I learned from them. But at the time, that was the best decision you made, and you can't be crippled by all the choices you have. Is it the right time? Is it not? You make your best decision, right? And then you move on. Like you said, you think about your next company. You can make more perhaps in your next company if you did leave something, on the table. So I don't focus on do-overs. I focus more, how do I learn from the mistakes? And then how do I, make sure I continue to optimize my business moving forward?
And you have a great quote that I read somewhere where you said that the failures are okay because the wins pay for the failures.
So in my business, 90% of the drugs I research will never make it to market. 90%. Right? So if I let failure kind of paralyze me or get in the way, then my whole business model falls apart. It's all about being disruptive and finding the drugs and trying to improve those probabilities, right, with the skill that you have, so that you have a better chance than that. But that's the focus, and that's how I think you change patient care by staying focused. On that.
And do you think about market size?
You always have to, because look, I say I'm here for patients first. If I do that right, the investment and investors, take care of itself. But market size is tied to that, because you need access to capital to innovate. I mean, healthcare is just like every other industry, right? Capitalism drives innovation. And so you have to think about market size, because if you don't, it's not going to give you the access to capital to fund other aspects of your portfolio. So we talked about neuroscience is how we started, but we're in several areas now of immunology, oncology, cardiology. And in order to, research and advance those treatment paradigms, we need to access that capital. You have to think of market size. You have to think of pricing, right? And these are controversial issues in healthcare, right? To think of, access and pricing, but those tie in to innovation. And that's how our system is set up. You're supposed to have branded periods of time where you get profitability from a drug, and then it's supposed to go to being dirt cheap and generic forever, right? And then in order to beat those generics, you better have a better paradigm shifting, drug. So you have to think of the economics, but you have to do it in an ethical, moral way as well.
I love that the goal is to make it cheap for everybody. Yeah, so good. Mike, what about you? I mean, when you really think about this, is there something that you'd like to be able to rewind time for, or are you too busy thinking about the next thing that people are going to care about in 10 years?
Yeah, I usually think about just the science and whether the project is sort of interest to me. So, for example, I actually came up to New Haven area to start 454, which put out the first genomic sequencer instrument. We could argue about Illumina winning, but yeah, no, we couldn't argue about that. But when we put out that instrument, I thought that, it's a famous quote by Tom Watson, computers, why does the world need more than three? And I thought, when I came up here, why do we need to build a human genome sequencer? How many people want their genome sequenced? I didn't at the time. But I thought the project was really interesting, to be able to sequence a human genome in a day. That was quite visionary. That was Jonathan Rothberg, by the way, who sort of came up with that remit. And then he handed it to me and said, "Here, make it happen." But we did it. I appreciate what Vlad's saying, but for me, it's just about, is it something I haven't done before? And is this something that, I don't want to say, is it worthy of my effort? It's just, is it worthy of me taking the time to try to figure out how to do it? Mm-hmm. I don't worry too much about the market, although I won't work on anything of which I don't feel that there's going to be a market for it. So I'm not working on any disease or anything like that. It's just the tool that I'm developing. Will people need it? And so that's a little harder to project, because it doesn't exist. So the story about 454 is, when we put out that instrument, bioinformatics didn't exist. So who was going to actually use this genomic sequencer, when at the time people were sequencing a KB of DNA, and we were building something that was going to sequence 6 gigabytes of a terabyte of information being thrown out there. No university in the country, in the world, was able to handle that data, and yet eventually it prevailed. And so that's an example again where it took us 3 or 4 years to get that instrument out, from developing from the start to the end. So we had to project out, saying that 4 or 5 years from now, people will be ready for an instrument that will sequence the human genome. And then we had to convince every university to take one to see if they could play with it.
Wow.
So for me, it's always the science driving the project.
So when you think about everything that you've been able to do here in the state, Mike, why do you think that Connecticut is a great place for entrepreneurs to put up a shingle?
I think in any state, it's probably 1 or 2 companies that germinate the idea. I think, like in Branford area, in the Shoreline, Jonathan Rothberg did a great job of starting a bunch of companies and having companies Curigen spin out from there. I know in San Diego, it was the company that invented Sandwich Eliza's. I can't remember their name now. But almost all the companies started from that. And I think that's what it takes, is just somebody to sit down and say, here, let's do this. Grow the company up, and then have those people who joined it say, hey, I could do this. Let me go ahead
Continue
and start.
to proliferate over and over again in a community.
Yeah, and I think that's why New Haven has done it, and other regions. I mean, Stanford could have done it. There's no reason it had to be New Haven, but I think New Haven's done a good job of fostering the initial biotech, and I think CI, I'll plug them, has done a great job of fostering that. When you go to CI, the attitude is, how can we make this happen? You go to other VCs, it's kind of like, why do we not want to invest in you?
Yeah.
Although they'll never tell you that. It's always, we're here for the B round. and you're there. There is no B round if there's no A round.
Exactly.
I hear that
Get
so
to the
many
B round.
times. I hear that so many times. Yeah, let's stay in touch. And so what I think people don't realize, you have to speak to 10 VCs to get one to come in. But with CI, it's different, because they'll actually hold your hand and take you around and introduce you to people who have more money. So,
Andre, how was your experience with CI? I know that they were one of your early stage investors for PHWTND, and were with you the entire time until your eventual sale.
Yeah, no, CI was my first institutional investor. Right back then, I think CI came in December of 2013. Back then they had like a matching fund, so you put up 75,000 and they do 150,000 at like a really low valuation, I think it was like 1.5 million post money or something, and they sold out at 110 million. So CI did pretty well, right? Yeah. So, I think one thing, just touching on the New Haven and Stanford thing, I think one of the things, going back to the original question about Connecticut, is like, there's no major single city in Connecticut. Connecticut is really a rolling, really dense suburb for 100 miles straight. But there are kind of pockets of focus and expertise. Right, biotech and stuff in New Haven is really exploded. I think what's interesting about Stanford is, I think Stanford has done a great job of transitioning from like a secondary finance hub in the 90s and early 2000s to like this media and entertainment center that a lot of people don't appreciate. So like NBC Sports broadcasts out of Stanford, CBS Sports, Stanford, WWE, UFC, MLS just moved to Major League Soccer to Stanford. There's a lot of the back-end technology, ad tech companies. So Stanford is kind of doing that. Obviously, you have the insurance and the InsurTech in Hartford. So I think that's what's interesting about Connecticut. But in terms of Fairfield County in particular, and this is something that benefited PHWTND and then my new companies, is you're able to pull from up into New Haven, Danbury, Waterbury, all of Fairfield County for talent, but you're also able to pull up from Westchester, North Jersey, and New York City. And so I think just the access to talent, particularly in kind of the western part of the state of Connecticut, is akin to really New York City, but with a much lower operating cost in terms of office space and some of the other stuff. So I think that's something that Connecticut can really focus on. And I think CI has, we were in the Stanford Innovation Center, like a co-working space, our first year. And I think half the companies in there were CI portfolios, and half of those companies have exited.
Wow.
Right. So all one in the same like little building. So I think, there's definitely a lot of opportunity in Connecticut.
So Vlad, you have to arguably one of CI's biggest success stories. I mean, Biohaven is a juggernaut. So when you think about being here, being in the state, your relationships with Connecticut Innovations, Matt and Allison and team, and what you're able to continue to do after a historic exit and continuing to proliferate new companies, new ideas, new drugs, new resources for patients and customers. How important is your relationship with the state?
Oh, it's really critical, because I think Biohaven, and me personally, I'm the product of, I think, what the state offers the best of, right? When you think of the legacy and tradition of public-private partnerships here and what created the ecosystem for us to flourish, I'm grateful to Matt. CI has really set this innovation standard in the state. Early investors in Biohaven believed in us and our vision and our future. And so it's not surprising that leaders like Matt, but also leaders like the Governor Lamont, and Dan O'Keefe and others, they have a deep business experience. And this current entrepreneurial ecosystem that we have is thanks to their leadership. They get the business side, they get the policy side, and then it's in the backdrop of a state with incredible talent. And when you look at our field of biotech and healthcare, look at what this state has done. I mean, Pfizer and Groton saved the world with a vaccine, but look at the long list of drugs that's come out of Connecticut from Pfizer, Zithromax, antibiotic. I'm sure everyone in this room has probably taken Zoloft as an antidepressant, and a whole bunch more that we need when we're faced challenges, right? But other, if you look in the more recent, what Alexion's done with Solaris, what SpringWorks has just done, they were just, acquired for a drug for neurofibromatosis, really impressive. And then Biohaven, of course, with how we've changed the treatment for migraine sufferers. So this state, I think, is an ideal place, and we're very grateful to, our current leaders who are really fostering this biotech explosion here. And also, I have to mention Josh Glabell at Yale Ventures, who's teamed up with Matt to really bring it to the next level so that we can rival a lot of other ecosystems.
So when you're thinking about the next 18 months, 3 years for Biohaven, is there something that's on the horizon that you're super excited about?
So there's a lot I'm excited about. It gets back to the access to capital that you talked about, because with more capital, we could do a lot more. We have an amazing, talented team, here. We made our mark with migraine, right? And I have to tell you, most of our employees could have went home and retired after that, but it showed you it wasn't about the exit. It's not about how much you make, but it's about the impact. And so our team wants, in the next 18 months, how do we change treatment paradigms for epilepsy, for bipolar disorder? We have some really cutting-edge cancer treatments. And then in immunology, with some technology that we have from Yale, I think Biohaven is going to bring precision immunology to the field, where we can target specific autoantibodies and hopefully prevent disease. We talked about diabetes as one. Early onset type 1 diabetes is in our target. So we have lofty goals. Lofty goals the next 18 months.
And we're so appreciative for that. If anyone knows, I have a son with type 1 diabetes. He was diagnosed at 17 months old. He's 18 now, and he's been in the thick of it. It's a real battle. And I think a lot of the challenges for parents, caregivers, people living with autoimmune issues is you feel like the cure is going to be there in 5 years. When Walker was first diagnosed in 2008, I sat on the International Board of Directors for the JDRF, and I'd go to all these meetings for special diabetes funding in DC, and everyone that I talked to, the smartest minds in the world, would say, just hold on tight. This is your new normal, but you're going to have a cure in 5 years. Well, 16 years later, we're still waiting for a cure, and there have been some amazing pump therapies. There's all kinds of different continuous glucose monitors and incredible technology, which is wonderful, and I'm very grateful for, certainly. His A1C is 7.3 for the first time in his life. We're proud of that, but it's not a cure. It's not a cure. So the work that you're doing at Biohaven really does change lives for everyday people, like my walker, like me. So please keep going. Let's get this man funded. I've got a personal interest over here. Matt, this is the first time I'm saying it. I've got a horse in the race. I will tell Matt, I don't have a horse in the race. I'm not invested in this. I'm personally invested in this. Andre, what about you? You have a new company. You're bringing a Major League Soccer team to Bridgeport, Connecticut. How can we support this incredible goal of yours?
Buy season tickets this summer. So, no, you talked about public-private partnerships. So, one of the things that we've been doing, we've been working on this project since 2021, right? It took years to find a stadium site. Then you have to get zoning approval. Then it's not just municipal and state, it's federal because it's dealing with FEMA floodplains because the stadium site's on the waterfront in Bridgeport. Then as you start to do the financial underwriting, you realize that there's a lot of infrastructure work that's needed. So we were able to get from DECD and the state $60 million in grants to clean up kind of the brownfield site. Next to it, we have to raise the bulkhead to stop the flooding. Also, one of the things like dealing with the community there in Bridgeport, they talked about the dire need for housing. I mean, there's a housing crisis in Connecticut.
In the country.
But Connecticut has actually had the lowest rental vacancy rate of any state in America, right? So we're talking about both the market rate and affordable housing crisis. And it's been really hard to attract private capital to build housing in Bridgeport. And so one of the things that we realized was that the stadium was a real catalyst to bringing in private capital excitement for the housing. But then it still doesn't underwrite because of all the additional infrastructure work that is needed to get it. It's one level of remediation and infrastructure for a stadium. It's another level for housing, right? Because you have to have, you probably understand the science more than I do, but in terms of to be safe to live in and stuff like that. So really where we're at now, and thankfully, we last week, bipartisan, 146 to nothing, the House of Representatives in the state approved 190 million of tax incremental financing district for us to do. So there's still a lot of work to be done. But this is really, it's like a $1.2 billion project that is going to be, 75% privately funded. And so I would say in terms of support, and you can go to our website and you can write your local senator or congressman and tell them to vote for our next round of public funding, and tell Governor Lamont, I think I missed him, or else I would have been, urging him as well. And then I think it's just supporting the team. So one, I'll get off the soapbox, but one interesting thing that people don't realize is Connecticut is the largest population, most densely populated market in America, with none of the 5 major sporting teams. No MLS, no NBA, no NHL, no MLB, no NFL. We spend $1 billion a year, Connecticut residents, subsidizing New York and Boston media, entertainment, and sports. $1 billion of our money leaves and goes to subsidize our next door neighbors, right? We have more Fortune 500 companies per capita than any other market in America, right? So that's where you get your naming rights, your suite sales. Like, we're kind of losers if we don't get a professional team. And when I say losers, not like we individually are losers as people, but I'm saying as a state collectively, we're just losing opportunity. One of the things in terms of entrepreneurship and is talent, right? You're only as good as the talent you can surround yourself by, because no matter how good you are, smart you are, if you don't have great people working for you, you can't win. And one of the biggest reasons why Connecticut loses talent, young people graduating from college and stuff like that, is lack of housing and lack of entertainment. So they go to Boston and New York and DC. Well, I don't know about the housing, why they would go there, but in terms of the entertainment, right, they go there. And so that's another thing that I think that the state needs to think about in terms of bringing these bigger entertainment opportunities. So that's...
How many jobs would the stadium create, or this entire entity, this entrepreneurial effort?
So the Center for Economic Analysis at UConn said it'd be over 1,300 permanent jobs, $3.4 billion of economic impact to the state, and it'd be the biggest return on investment in over 4 decades from the state, this project.
That's amazing.
So that's their numbers, not mine, right? So yeah.
And Vlad, what about your company, Biohaven? How many employees do you have in the state?
We were at peak when we had a marketed drug about 1,500, and now we're down to about 350. Or so. So for us, it very much depends on when your drug gets approved. So we're waiting to hear from the FDA, despite all the turmoil that's going there right now. By the end of the year, to hear an important drug for us, and if that gets approved, then we'll be able to increase our employee size and launch another drug. But then importantly, that will bring the capital in to fund all the other programs and allow us to expand further.
Awesome. And Mike, when you think about the things that you're most excited next for Abbratech, and I know you're forecasting out 20 years, but just for smaller minds in the room, mine, What are you most excited about? What are you most passionate about that you're thinking about?
Now?
Yeah.
Yeah, this I told you. Most passionate right now, I'm thinking about a theory of evolution and how we could use that in biology.
Really?
So, yeah, really. So that's why, again, I've worked on genome sequencing at a time when nobody thought you could ever do that. And I'm working, I founded a company that's working on proteomics at a time when people don't know what to do with it. And so if we could make 1 million different antibodies against every 8th amino acid in the human proteome, what would you do with that? I don't even know what you would do with it. I just know.
Ideas.
Yeah. I know the
I don't even know what that is.
I know the obvious ones of let's make an enzyme inhibitor to every enzyme out there. Let's make a agonist antagonist to every GPCR. But it's going to be somebody somewhere else is going to think of what you could actually do with this. That's going to amaze me. And so I'm not thinking about that. I'm thinking about how do I deliver that tool to them. Because it's going to take me, again, 4 or 5 years to get there.
And just because I have to ask this question, it's nothing to do with CI. How old were you when you realized I'm the smartest person in the room? No offense, Vlad.
I'm not. In fact, when I was at strategy, and the boss said, "Michael, you don't need to walk in a room and demonstrate you're the smartest one in there." So I try not to do that.
But as a kid, though, I mean, were you just sitting around like, I can create a tool that can solve this problem, I can identify?
No, I think there are a lot of people that are a lot smarter than me. Probably half the room here, at least, or all of it. So it's not about being clever or being smart. It's picking the right problem to work on. If you have too many ideas, you're too creative, and I've met those kind of people. They don't know what to focus on. So it's got to be something that you can focus on that's going to take you a couple of years to solve. I think that's been the key, and then have the fortitude that I think these guys were saying to see that through and believe that you can get it done when nobody else again even knows that this is a problem.
Right. And so that's your kind of key to success, is being able to focus on something and attempt to solve it even when no one even knows that they need it or believes that it can be done. Vlad, what about yours? What do you believe your key to success has been?
Surrounding yourself with the right people. It's all about the team. I better not be the smartest person at Biohaven. I need a lot smarter people there, to help us accomplish the goals that we have. So I think that's the key to the success. Invest in your team. Make sure you continue to reward them for their efforts and celebrate their successes. So I think that's really important.
Sometimes when you're in a company, people talk about it as being a family, and then other people will say, I don't want my company to feel like a family. Where do you fall in an opinion on that?
We talk about the Biohaven family. It very much is a family. In order to, I think, take care of others and try to advance treatment, you got to take care of each other. Like I said earlier, with the 90% failure, you have to hold each other up, and you have to be willing to fail. You have to be willing to try to solve really hard problems, and we're not going to solve every one of them. And you have to be there for each other and have each other's back so we can continue to do this, so that, every so often you will come up with a paradigm shifting drug, and that makes it worth it. Like, to this day, I still get emails on an almost daily basis. There's 40 million people with migraine, and there's somebody out there who's sending an email to Biohaven thanking us for changing their lives. And that's what drives us. That's what drives the Biohaven family. And together, only by working together can we succeed. What
about you, Andre?
I would say very similarly, the team. One thing that I'll say is, like, I'm more afraid to have the regret of not trying than to fail. Yeah. Right? So, and I think one thing, and particularly in what I'm doing now, with the new tech company that I started, one of the hardest things the first time around was it takes years to build up your team. I had my co-founder, and I had a couple. My wife was the ran the company more than I did, frankly. But then it took years to get all the other people. This time around, I was able to just send out a few texts and a couple emails to people that worked for me previously, and we got to like 16 employees in 2 seconds. and we all know how to work with each other. We've been through the wars together. I was chuckling on the way here because my chief of staff and my CMO, they presented an idea to me yesterday. I didn't like. I pushed back. It was a little bit of an argument that I was wrong yesterday, and if you don't have people around you that are willing to push back and tell you that you're wrong, then you're not going to do very well. And then I was chuckling because we use Teams. I sent them a text on Teams this morning. So I left the meeting saying, no, we're not doing that. I disagree. And then I sent a message this morning being like, you guys are right, I was wrong, go ahead. Because I just, I thought about it overnight, right? I thought, and I was like, you know what, they were right? But I think also having enough confidence in yourself and enough kind of trust and comfort with the people that you are, that you can accept when you're wrong, so.
Well, you mentioned your wife. I know that you have kids. What do you do when you're not changing the world for fun?
So our kids go to school 45 minutes away from where we live. So we drive them to school every morning and pick them up. We alternate, and that's difficult, right? We have dinner together probably 4 days a week, which it was easy during COVID when you're all at home, but we've tried to keep that going but I enjoy what I do. So I go to our youth academy games on the weekends. I don't go to professional sporting events much anymore. I have more fun going to watch 13-year-olds and 15-year-olds take on clubs and we watch Shark Tank and all together on Saturday mornings. We're watching Hulu, so we don't got to see ads the next day, and we'll debate and pause it and predict what the bid should be, and that's fun. You know what I mean? We enjoy that stuff. So
what about you, Mike? I know you have 40-year-old children, which is still so hard to believe. I think deep down inside you're working on a Botox alternative that I need to talk to you about. I suffer from migraines. I'm allergic to eggs. I can't do Botox. So Mike, I'm coming to find you. What are you and your kiddos doing? Or your kid, not kiddos, they're adults. What do you and your wife do when you're not solving the world's problems?
I'm actually a professional potter.
Really?
Yeah, I do. I teach ceramics occasionally.
That's so cool.
At Wesleyan and Guilford Art Center. And part of it was, again, I hate to bring up my past, but when I was at Glaxo, they'd asked a question. It was very similar to I think what Vlad said. What is it like when you stop running? And it didn't occur to me, I would never stop running. And that was a problem at the time because it's a large pharma company. Most of your time is set around. I don't know about Biohaven, but you're just sitting around in a meeting, pushing papers around and not really feeling like I accomplished anything. And their advice was take up a hobby. So yeah, I do that. And I had always done pottery through. When I was in college, my dorm sat next to the art studio, so I took all my electives in ceramics, and part again because I was really lazy, and the dorm is Penn State, and so in the winter, that walk across campus was horrible, brutal. Yeah, so I took all my electives in ceramics, and then when I hit Glaxo and they said take up a hobby, I did. And now when COVID hit, I ended up taking private lessons in drawing portraits in pencil. The reason for that was in so many Teams meetings where you're not doing anything that I can now practice doing portraiture because you can't do ceramics while you're talking to people in Teams. But you can do portraits as long as the camera was not focused down on the table.
So cool. Thank you for sharing that. What about you, Vlad? What do you do when you're not solving problems?
Well, as the other panelists mentioned, family is really important. So family's at the center of my off time. But I love what I do so much. My main hobby, when I'm not doing Biohaven work, and that's all consuming, and not just pushing paper around, but I like to help other companies, and that's how you can extend, your reach. So, for example, Matt knows this company, Veridermics, here in Connecticut. There's a derm company. Reed Waldman is a CEO. I love working with them and helping, enable his success, right? He's an earlier entrepreneur, and so I do that as a hobby, help him solve some dermatologic problems. There's a local company called Brexorg that's making cutting-edge models of the human brain where they literally have a building with floating human brains, and we're learning everything about how the brain really works and taking a data lake from that, and then they use AI and others to understand it in a more complex way. So those are my hobbies. I love working on those things as a part-time, and I stay on brand. We're here for patients and trying to help people.
Do you still practice as a psychiatrist?
Still see a few patients. I do. I actually do so.
What do you have to do to get on the short list? You have to have a lot of issues. Thank you so much. Thank you so much to our panelists. This has been amazing.
Thank you.
How lucky are we that we get to learn from these brilliant minds? Thank you very much, gentlemen. We're going to just open it up for just a few questions, if that's okay. And we'll start with the young lady with the glasses.
I'm going to throw it out there. Andre, any plans for women's?
Yes. So, absolutely. So I've actually expanded the ownership. So I got self-funded, my wife and I, everything, the first 3 years, and then we're like, okay, we've spent a lot of money now. So we actually expanded the ownership group in November. So we brought on like Swedish Family Office and a few other folks in Connecticut and New York. And there was actually an announcement yesterday in like Sports Business Journal where we named like Wasserman, our agency of record, to do our naming rights. And in that, we said that we're going to bid on the NWSL team. So yeah.
Awesome.
I have a question for Vlad. With the advent of large language models, does Biohaven have any plans of providing LLM-based therapy in addition to drugs for mental health?
I think we have to stay on top of every technology, and it's a little bit different of a field when you're looking at interface of technology and devices into treatments. So right now we're focused on drug approaches, but what I think is really exciting in the field is layering in other technology and devices that can assist with a drug as well. So we're very interested in that, and I think entrepreneurs always have to incorporate the latest technology.
Yes, in the white jacket.
It's interesting to me that you're all still CEOs, being founders, because I think very often there's an inflection point in companies as they're growing where maybe the founder isn't still the right person to be the CEO. How have you guys thought about that? What's your experience been with that, and what would your advice be to other founders as they go on this journey?
So that happened to me maybe 3 or 4 years before we exited, where one of the board members was like, "Oh, maybe we bring in somebody more experienced to scale the company." I thought it was a terrible idea, and I was like, absolutely not, over my dead body, right? But I also had enough. Between my co-founder and I, enough equity in the company and the way the board was structured where it couldn't really happen unless I proved it. One story is a good buddy of mine, Mike Salguero. Have you guys ever heard of ButcherBox? Mm-hmm. Right, so we went to Hotchkiss together. He's the CEO, founder of ButcherBox. He was at our office in 2014. He was the CEO before that of a company called Custom Made. And he was at our office just stopping by, got off the Amtrak on his way from Boston to New York just to hang out with his high school buddies. He steps out of the room for a second and comes back like 20 minutes later, and he's like, "My board just fired me. I'm no longer the CEO of my company that I started." And he got a severance. He was like, "I'm not staying if I'm not the CEO." So he got a severance. He used his severance to start ButcherBox, and now he's a billionaire. So sometimes it works out, and that company Custom Made, they brought in some big exec from eBay, and they were out of business in 24 months, or so sometimes it's not the right decision. I think that the what I would say is, and it's hard to, because you have ego and you got to take it out of it, if you truly believe that somebody else at the helm can make your company more successful and thus make you more money and your investors more money, then I think it's the right decision. And if you truly believe that you're the right person to take it to that next level, then you should fight to continue that journey.
It's a great question. Oh, sorry, go ahead.
No, probably the same thing is that companies go through transitions. There's the startup of 2 or 3 people, or 1 or 2. I think they undergo a transition at 25 to 30 and over 100. And I'm always super impressed by people like Vlad and others who have taken it through that whole arc, because it requires just different skill sets along the way. And, I look at people like Gates or Zuckerberg. I know they're unicorns, but it's super impressive what they've been able to do. That was a smart. I couldn't do it. It just, I don't want to do it.
It's a great question. It's really healthy, right? That you keep on reassessing, like, are you the right person, for the role? And a lot of people don't do that. And you have to know who you are. And so, like, for Biohaven, I know who we are. Like, we don't want to be a 20,000 person company. We don't want to be a big pharma company. It's inefficient. We want to innovate. We know who we are. So as long as we stay in that right culture, then I may be the right person. But if we, were to scale up, I wouldn't be the right, person. So I think all entrepreneurs should ask themselves that and be honest to their investors.
I think you have to. At some point in your life, you've got to look and say, what is it I like doing? And it's not about the money, because you could be the CSO, for example, and do really well, founding the company and doing really what you want is the board seat. That's the real power. But to prevent anything else, but you really have to evaluate yourself and just say, what is it I want to do, and is that enough? And again, for me, where do you want to stop running? And yeah, CSO is for me a sweet spot for that. So and that transition is incredibly hard. So you shouldn't think about, in some cases, going from a startup to the next Genentech or Amgen or whatever, if that's not what your life's goal is. And as Andre said, at some point your board's going to come in and question you whether you're the person to do it or not, because it's their money. When they have $100 million on the line and they can bring in somebody from eBay who's now going to raise that value to $200-300 million, it's always about the money at that point. So unless you can convince them that you're the person.
Does anyone else have any other questions? Do our panelists have anything they want to add? Oh, one more. Yes, and Zach. This is my CFO, Zach Cohen, everybody. Hey, Zach.
What happens when you have a bad day? We talked a lot about a good day. What do you do? What's the mental fortitude to get through those bad days so you don't project the negativity on your company and your team?
I think that's
Great question.
What I think has already been said was that your job is not to do that. Is to you get paid, or you get whatever your remuneration is, so that you don't have that you work through those bad days. It's easy to be CEO or any employee on good days. It's hard. I mean, we have a lot of SBIR money, for example, and politics aside, there was a problem in February where all NIH money was just held. That was a bad day. That I honestly, I didn't know if I'd be in business past July. Luckily, the money got freed up, but that was only a month ago. To where now we're good till next year. That was a bad month. Worrying about that, because again, I said my job is about keeping everybody employed, and I didn't reveal to them we're that close to being out of business, and it's a black swan event. It was nothing I did. So, but the money was freed up, so we're fine. Yeah.
Good.